Hey everyone, how's it going? So something that you might encounter after a code blue situation is done and your patient achieves return of spontaneous circulation or ROSC is that sometimes our patients can actually have a very, very low blood pressure, which would be really bad and could potentially cause them to go back into a code and cardiac arrest again, which we don't want. So one way to fix this situation is we have to increase our blood pressure with medications. So as a pharmacist, one way that I help the team is by expediting these blood pressure medications called vasopressors by creating dirty bags on the floor. So a dirty bag, all it means is that I'm creating a bag outside of the IV room, which is the cleanest part of the pharmacy where we create all our medications. So instead, in emergency situations where we don't want delay, I'll just create a bag on the floor just to get us through until the IV can make us a cleaner bag. So the first thing I do in this situation is obviously confirm the medication. Here in this demo, I'm going to do Levofed. So Levofed is right there. Hopefully you can see it. It's also known as norepinephrine, and this vial comes in 4 milligrams in 4 ml, so 1 milligram per 1 ml. And we're going to compound a bag that contains 4 milligrams of Levofed in 250 mLs of fluid. So here I have NS, but you could also do it in D5 or dextrose 5 with water. All right, so I have my bag here, got my medication here. Next I have alcohol swab and also my syringe. So these are the 4 things you'll probably need, and also a label, which we'll get to at the end. First thing I do, just clean the bag. You want to just clean the rubber part where you're going to put the needle, and then you just want to clean your medication really quickly. Next thing I do is I get my syringe. I'm going to drop the air that I need, so I'm going to drop 4 mLs right there. Careful of your sharps. Whenever you're in a code, just always be careful. Make sure that no one's bumping into your elbows. Here I have the medication here. You can always support yourself by just pushing it through the table. Push the air and just drop the medication in. So here I actually put way too much fluids and water in here, but that's okay. So you might have some overfill leaking out. It's totally fine. Once you have all your medication, you're just going to push it up. So these medications have overfill, so I just double check that I have the right volume. Here I have 4 mLs right there. Perfect. So now I grab my bag. Here's my bag, syringe, just carefully line it all up, straight down, and just inject like that. So very easy to do. Now pull this out. Now for your sharp, you always want to cover your sharp, so go perpendicular like this, and then easy, bam, safe now. All right, so now that we have our bag here, we can't just give it without a label because that would be unsafe. So I had my teammate, or I will have my teammate in a code actually make me the label. So I'll put that right here. And I have Levo or Levofed, 4 milligrams in 250 mLs. The next thing I'll do is help the nurses by either getting them a pump, priming the line with an IV, primary IV tubing, and then I'll actually help determine the dosing based on the blood pressure. So the typical dosing for this is between 2 to 20 mics, and that's a non-weight-based dosing. Sometimes in pediatrics you'll do weight-based dosing, and you can even go higher than that depending on the situation, although 2 to 20 is the most common dose. Some other things, Levofed is used for primary for sepsis and other shock situations. And then again, it's really good for squeezing the blood vessels and also increasing heart rate. So good luck in your emergency situations. Hope this was helpful for you, and always stay safe out there. All right, thanks for watching.